The 𝗪𝗧𝗋 framework. We are introducing a framework for sustainable living. Now, if we were to take the vitals of sustainable health and healthy living, what would we measure? The clinical vitals ask, what is happening in the body right now? And in this episode, I'd like to tell you what the 𝗪𝗧𝗋 framework will ask you. This is it. What is happening in the life of an individual that sustains their body over time? Welcome to the Hope Ignites Healing podcast with your host, Dr. Lillian Kalisa, a space where we speak everything holistic health and healing. This is a space for women especially who are seeking to find healing, that is, from a place of inner completeness, making small, simple, and yet tangible steps towards full health, and therefore a lifestyle of healing. In this space, we believe in the 1948 definition of health, that health is a state of complete emotional, physical, and social well-being, and not merely the absence of disease and infirmity. And through my personal story and all the medical knowledge gathered through the years, this is now the mantra with which I live my life and teach others to do the same. Now let's redefine health together, shall we? Welcome to Season 4, The Rebirth. Hello, my friend. Hello, my listeners. Hello, my people. Thank you so much for coming again to dig deeper with me about the 𝗪𝗧𝗋 framework. In the last episode, I introduced the philosophy. I gave you a preamble into this thing that is becoming so passionate and real at the Holistic Health Hub, inspired by yours truly and the work I've done in clinical medicine, public health, and health and wellness advocacy. Now let's get into it already. I'll tell you that as clinicians, we are trained never to make decisions without first taking vitals. The vitals that you measure every time you go to see your clinicians, that is your blood pressure, your heart rate or pulse rate, your temperature, your oxygen saturation. We measure these readings, simple as they are, because they tell us the state of the body in real time. And these are monitors to how you're progressing, whether getting worse or getting better, even before we do any intervention on your body. Now, over time, in my long duration of clinical practice, I began to realize that many of the challenges that patients were facing, especially women, were not just physiological. I love women. Look, I'm a woman, right? They are structural, emotional, relational, and lifestyle driven. So I began taking a different question. I like going to the why, and this was it. What would it look like to take the vitals of sustainable living? The answer came through the 𝗪𝗧𝗋 model. 𝗪𝗧𝗋 emerged from that clinical thinking and asking questions, expanding the logic of vitals from the body towards whole health, whole life, and holistic living. Where is the starting point if we are to assess how one's life is in regard to living well and living whole sustainably? 𝗪𝗧𝗋 brings these elements together into one coherent system. Let's make a comparison or an analogy just to clarify it, right? Since vitals is very, very easy to understand, we've all had our vitals taken. Here is how the relationship comes in. When we are doing clinical vitals, we look at immediate physiology. How is your body at that time? 𝗪𝗧𝗋 framework, vitals, will assess sustainable well-being. What is happening in your body that assures us sustainability? All right, or assesses your sustainability in well-being. Clinical vitals will make an acute assessment right on point in real time. 𝗪𝗧𝗋 assessment will give a longitudinal assessment, a long-term and ongoing assessment of your well-being. Clinical vitals are a measure of disease detection. Yes, they are. For example, if your heart rate is excruciatingly high, probably over the 80s and 90s, it will tell me something is happening to the way blood is flowing from your heart. VitalWise gives us a pattern detection. How are your patterns contributing to the way that you're living? Clinical vitals give you survival status in real time. The VitalWise vitals show us the ability to thrive, your thriving capacity. So at this point, allow me to briefly introduce the pillars in VitalWise, not to teach them fully in this podcast. I'm so excited to get to share this with you, but I would like to orient you, my audience, to the way this framework really thinks and how it goes into the work that we are doing at the Holistic Health Hub. Remember, it is rooted in real medicine. Are you ready to dig in with me? Let's get going. So VitalWise is V-I-T-A-L, which is vital, and then wise, W-I-S-E. The V is validate health status and context. The I is identify root drivers. The T is for therapeutic lifestyle integration. The A is for aligning meaning, identity, and support. The L is long-term systems and continuity. Wise is wisdom for integration, stewardship, and empowerment. So let's get into it together. We'll start with the V, digging in a little deeper. V is to validate health status and context. That is we're talking about sustainable health, beginning with understanding. So validating health status and context, we're not talking about just symptoms, but we're talking about a patient's or a person's context. All right? In family practice, in family medicine teaching, for which I'm a family physician, we've been always taught or empowered to apply patient-centeredness, my passion, by applying a 3-stage assessment when we're taking clinical assessment of a patient. So in diagnosing an illness, we use clinical assessment, clinical acumen, clinical judgment, right? And then we use an individual assessment, that is understanding the patient's personal experience. How is the illness affecting the patient? Because the person is an expert in their illness. Has it affected their going to work? Has it affected what has it affected them as a person? Has it affected their financing? Has it affected them waking up and dressing themselves up? So there's the individual assessment. How has the illness affected the person? And then there's the contextual assessment, evaluating the patient's environment. Is the environment contributing to the disease, or is the disease changing the environment? Is the disease causing estrangement to the people around them? Or is the people around them contributing to their disease? Is it making their hypertension worse? That is the 3-stage assessment that is taught in family practice. So as we validate health status, we don't only validate the individual, we apply the context. So therefore, this approach in the V helps clinicians, particularly in primary care, to manage complex cases by considering biological causes, psychological contributors, and social factors for better quality patient management. So you're talking about the patient's lifestyle, their stress load, their environment, the season in which they are in their life. Somebody could have high blood pressure because they are going through a death in the family, and yet they are not hypertensive. Would you go on and give medication without assessing the context with which the disease presents? So we cannot intervene wisely if we do not first see clearly. Same applies to wellness models. So the V, validating health status and context, is the usual assessment you have with your clinician, where they are assessing your clinical needs, explaining your disease processes, and managing them. That is the V. And that's what I trained to do as a physician or as a doctor in Uganda. And then we go to the I in VitalWise. I is identifying root drivers. So we are looking at beyond surface readings. And this is where it took a step further than just medical practice. Asking those questions. If the blood pressure is high, we ask, why is it high? If fatigue is chronic to a patient, we ask, why is it chronic, than just giving a pill and a solution. If you've been here long enough and you've heard my story, I was broken emotionally and I had to go deep and ask, why am I broken emotionally? What have I let go of that has caused me emotional pain that later ended into disease processes? Without just treating a symptom, I had to ask the why questions. So this pillar moves from symptom management to driver assessment. What is driving the symptoms with which you are presenting right now? Many health challenges are not random. They are driven by cumulative factors, things like chronic stress, emotional load, lifestyle patterns, unresolved transitions in our lives. So VitalWise will always ask, what is driving this beneath the surface, beneath a symptom, beneath just a presentation? And are you ready for the T? This is getting exciting, right? The T is therapeutic lifestyle integration. We are talking about the daily stabilizers. This is where regulation happens, like we talked about in the last podcast. Regulation of emotions, regulation of your sleep, regulation of movement, nutrition, the rest of the rhythms within your life. Lifestyle becomes the quote-unquote maintenance therapy of health. Lifestyle is not background noise. It is actual medicine. It is sustainable management of life and how to live well. Sleep, movement, nutrition, rest, and rhythms are not optional add-ons in our lives. They are as important as a prescription I will give you to manage an on-spot diagnosis. They are foundational interventions, but they must be realistic, not idealized. And by all means, not a feel-good, motivational, or inspirational address. They should be clinically grounded. And then we go to the A. The A is align, meaning, identity, and support. Here we're going into the psychosocial vitals. We are assessing feelings, all right? No treatment plan succeeds if life is misaligned. We are assessing alignment. We are assessing you finding your North Pole. Where is it that you are aligned towards? Here we assess purpose. Believe it or not, we assess identity. Who are you as a person? We assess faith. What do you believe in? We assess relational support. Who is in your support framework? Who is in your support? Who is in your arsenal, right? If you remember, I've shared the WIN acronym before here as we're talking about living well. That is the W, asking the why questions. Who am I? Why am I here? Why am I doing what I do? And then the I is introspection, taking that quiet time to introspect and check and assess from within. Checking your emotions. How do you feel today? And why do you feel the way you do? And then the N is your network. Who is in your arsenal? Who is here to support you on the values that you've chosen to walk with through your life? Because meaning regulates physiology, believe it or not, healing accelerates when life makes sense. And at this point, I would like to make reference to episode 5 on emotional wellness that we had right here. It was titled Emotional Wellness. That is, in that episode, we talked about addressing the PERMA model, PERMA, that is rooted in positive psychology. In that model, we described 5 core elements that help people flourish, not just survive, but to truly thrive. And let me go to the M directly. Each of the letters had a meaning. The M in that model was finding meaning. That meaning comes from belonging to and serving something that is greater than yourself. Whether it's your faith, or you're serving family or work or community, what gives meaning to the service you're doing? And we said that it gives one a deep sense that life really matters. And I'll tell you that people that live life without meaning, research has shown, have the highest rates of depression, mental illnesses, even chronic illnesses, as we see. And I remember in that episode, I asked us to reflect on your why, like I usually do, to ask yourself what gives your life direction and purpose when you awake every single day. So, in VitalWise, the A, aligning meaning, identity, and support, purpose, values, faith, relationships, and identity, all these influence how the body responds to stress and change. Believe it or not, these guide the physiology of our body. In practice, many times, I've had patients that will come in with clear physiological symptoms. And in doing the physiological assessments, there's literally nothing going on. And then you ask, is there something that is keeping you awake at night? Of course, usually there is chronic stress and someone thinks it is normal to be stressed out. No, it's not physiologically proper for you to live in chronic stress, because that is the root cause of disease processes. So we are not treating bodies in isolation. We are caring for whole lives. That is why we are aligning meaning, identity, and support. Why do you wake up to do the things you do? What is your purpose? What is your assignment? As we go deeper into it, we go to the L. The L is long-term systems and continuity. Here we are talking about follow-up and continuity of care in the VitalWise model. The L is for long-term systems and community and continuity. So we are talking about sustainable living requiring the same as we need routines for sustainability. We need to set boundaries for our health. We need to review our existing systems. That is why programs like the Discipline Challenge have been made in the Holistic Health Hub to support you that your health needs certain disciplines to be aligned for you to live that way long term. And this is where many of our efforts fail, I'll tell you. Without systems, change fades. Without having pre-aligned systems and routines, planning, you are continuously trying to make things work. And that is a major cause of stress and ill health in your body. So VitalWise emphasizes routines, boundaries, reviewing these routines, planning, and gentle accountability. Not a restricted life, but actually an eased life because systems are in place, something that is sustainable. Finally, we go to the WISE, that is W-I-S-E, WISE. WISE is wisdom for integration, stewardship, and empowerment. Here we are talking about discharging an individual into self-leadership. In my programs, I usually teach about empowerment. I say you become your own doctor, where you don't rely on Dr. Lillian to tell you what to do every day, where you don't rely on your financial expert to hold your hand and tell you where to invest or do things every day, where you don't rely on your religious leader to guide how you should live spiritually. This should be a support in a framework you have set for yourself. So ultimately, the goal in WISE, wisdom for integration, stewardship, and empowerment, is this. We are not creating dependency on care. There has to be a limit to where care stops and an individual is empowered to carry on. It is capacity, it is empowerment, it is sustainability. Health that lasts is health that is understood, stewarded, and shared. From your story, you're able to share it and replicate it to the next individual. Hence our programs. VitalWise is not about doing more. It is about doing what matters consistently. It is not about fixing yourself. It is about supporting yourself wisely with a framework in the background. It is not separate from real life, neither should it be separate from clinical analysis. It is rooted in clinical medicine. It's not separate from clinical analysis and management. It is designed for the complexity of real life today and beyond, especially for women balancing responsibility, care, leadership, and transition, as well as full health. So, if you've been here long enough or you've interacted with me in my work, you could have recognized elements of VitaWise already. VitaWise will inform how we think at the Holistic Health Hub, how we teach, how programs are designed, how group spaces are structured, and how healing is paced within our model. You will see it expressed through conversations that we carry on here, through the retreats that we set, like the one coming up where I've invited ladies to join us for the wellness retreat in the International Women's Month. That's March. Look out for it in any of our platforms, especially on our website, right? www.𝗪𝗠𝗪𝗏3.com. You will see it in our guided pathways that we plan for our community. It will always be adapted to context, always grounded in reality. As we get to the close of this, it has been a mouthful, but I'm so glad I've been able to put it forward. Finally, as you sit with this framework, here is what I invite you to do or to consider while you're with yourself. Are you ready for it? Where in your life are you relying on effort when what you really need is structure? Where might true wisdom replace pressure? I'll say that again. Where in your life are you relying on effort when what you really need is structure? Where might true wisdom replace pressure on your body? Now, you don't need to answer this right now. Think through it. Orientation comes before action, but realignment is key. So VitaWise exists because sustainable health requires more than intention. It requires a way of thinking that honors the body, respects the nervous system, and supports life as it actually is. You don't need to rush into this. You don't need to master it all and cram the acronym saying Dr. Lillian has given us assignments. No. Frameworks are not about speed or cram work. They're about direction. They're giving us a compass. They're answering the why. Why are we doing the things the way that we are doing them? And direction, when chosen wisely, changes everything. When you encounter me, my work, the initiatives at the Holistic Health Hub, this is our orientation and this is our compass, VitaWise. VitaWise is the intellectual home for everything that follows after this podcast. I really appreciate you for hanging in with me. This has been long from the last episode up to now. I want you to ask all the questions. For the next episodes, we'll go deeper, maybe into each of the pillars of the framework as we keep integrating it, as I bring in more people to discuss what it means to them to go to their doctor and be assessed holistically, right? I'm always here to serve you. It's always an honor to be part of your space, right? Through the Hope Ignites Healing podcast. I'm here to inspire hope through health and above all to add the glow to medicine. I'll catch you on the next one. Don't miss out. Take care of yourself. I'll see you soon. Bye-bye.